All right, using a foam roller. So on the floor, this is good to use. You can get into the neck a lot better when you have a foam roller. Just kind of put some pressure on there. You can see I'm lifting my hips with my legs and I'm rolling into that foam roller. You can lean to the side and get more of the side of your neck and the top of your shoulder with this one. So this is good to use on the floor if you are rolling out your upper traps. Using a massage ball, this would be a little bit more intense, so kind of be cautious when you're using this. Again, you're going to lift your hips with your feet, and you can get a little bit deeper and more in between the shoulder blades as well as you're doing the upper traps. And I get some range of motion here while I move my arm, so that's something that you can do as well. But this is a good tool to use to get deeper into those upper traps. Now we have the massage ball against the wall. So this is a good option because it can be a little intense on the floor. So this will kind of help you dictate how much pressure you want to put on those muscles. So again, you can just roll back and forth, up and down into the traps. You can get a little higher into the neck if you'd like, or just keep it kind of in between the shoulder blades and on the top of the shoulder. Again, better option to use it on the floor because it's less intense, but you can still get some good release against the wall. All right, my favorite, Theracane. All my clients should have one of these by now. This is a great tool. You can get into the neck, along the shoulder blades. You can get high into the traps as well. You have those two little knobs attached, then you can get along the cervical spine pretty good as well. I didn't really demonstrate it here, but just know that is an option. These are tricky to use, so make sure you're pushing down and forward as you're using this, okay? So down and forward, and that'll help get into those traps. All right, so massage ball. These I always recommend. I recommend these more than anything, is using the ball against the wall because you're able to get some good pressure on there, but it's not going to be too intense to where you can't do it. If you are someone that has larger breast tissue, I would recommend getting a larger ball. When you do these, make sure you are getting attachment to attachment. So get from the center of that chest, so that sternum, all the way to that shoulder joint. And you can go up and down as you're doing this. You can move your arm around to create some range of motion and active release as well. But I definitely recommend using massage balls when you are rolling out your pecs and you want to get a little bit deeper. This is a little bit trickier. This is the foam roller. You can use a foam roller on the floor, obviously. You're gonna have to position it kind of at an angle and put some good pressure on that pec and maneuver using your knees and your opposite arm. Okay, that's how you're gonna be able to move around on the floor with this foam roller. And again, these are good for getting into that deltoid and get some bicep as well. But balls are better, in my opinion, against the wall for the pecs, especially if you are a woman. This can be a little bit challenging. All right, muscle scraper. So this is one of my favorite tools. You see here, it's very easy to use. You're just going across. You can go up and down the muscle fibers as well. You're going to get more superficial work, so you're not going to get too deep into the muscle, but it is going to help with blood flow and creating some movement in that shoulder joint as well. Same thing here with the thumb saver. These are very good. You can get a little bit deeper with the pressure. Okay, you can dictate how much pressure you're putting on there. Again, you can go across, you can go up and down. You can spend a little bit more time on those knots that are a little bit more tender. But these I definitely recommend that you use daily if you can. All right, so I have the massage stick here for getting those pec minors. Okay, so the pec minor is a little bit tricky to get to. You're gonna have to go underneath the larger pec major muscle, and you press upward kind of towards the armpit, and you press forward. So you kind of up and forward when you're getting in there, and same thing as you do with the pec major. You can move your arm around, get some active release, and increase that range of motion. All right, first up we have the Theracane. So the Theracane is great to use, especially on the Infraspinatus, what I'm doing here. So it's on top of the shoulder blade, so I know it's hard to tell from the video, but it is on top of the shoulder blade. You can get some up and down movements, you can press and hold, but this is a good option to use for the Infraspinatus. For the teres minor, we're going to be on the side of the shoulder blade. Okay, so it's on the side of the shoulder blade. You want to get some good pressure, so you can go press inward like I'm doing there, and you can press in and forward. Okay, so you can do some circular movements there, but this is how you attack the teres minor. Supraspinatus. Okay, so we are on the top of the shoulder blade. Okay, this is a tricky area to get to, but you're literally trying to press on top of the shoulder blade when you're getting that supraspinatus. It's a very small area to get, but it is effective once you start finding exactly where that muscle is. Okay, moving on to the massage ball against the wall. This one, again, is on top of the shoulder blade. You're not going to be able to get your teres minor as effectively as you would with the Theracane, but you can still kind of get the side of the shoulder blade. This one's going to be primarily for your supraspinatus and your infraspinatus muscles, but this is a good option to use if it is easier for you to stand when you're doing some muscle release. The other option is a massage ball on the floor. This will be a little bit more intense. You can get some much deeper pressure, but I would not advise doing this if you do have pretty tender rotator cuff muscles, because of how much pressure is going to be placed on there. Again, we're going to get mostly infraspinatus and some supraspinatus when we're doing a massage ball on the floor. You could also get some teres minor as well, but again, this is going to be primarily those two, infraspinatus and supraspinatus muscles. All right, with the foam roller, now you're going to primarily get your teres minor and your infraspinatus with the foam roller. You can get part of your supraspinatus, but that's not the best muscle to try to get with the foam roller. At best, sticking with the two. Again, you're just going to kind of roll onto the side of that shoulder blade to get that teres minor, and you can roll on top of the shoulder blade as well. This is a good one to use. It gets you moving around on the floor, get some mobility as well. All right, lastly, we have the massage stick for the subscapularis. Now, this is a tricky muscle to get to. You got to press on your shoulder blade. So the front of your shoulder blade, you're going to press on, and as you're doing that, you can move your arm around, move it forward and back to get some range of motion in there. It's going to be pretty tender, so kind of play with the pressure, but this is 100% the best method to use.